And I have the honor and pleasure today of introducing our panel, Advocacy Strategies for Maternal Health When the Movement May Feel Stagnant. And our guests here today are from marchformoms.org, which is has always focused on federal advocacy efforts to improve maternal and family health outcomes. And you can learn more about March for Moms in the Whova app, but I want to introduce our guests. So we're joined by Laneceya Russ, who is the executive director of March for Moms. She has a master's degree in communication from University of Louisiana at Lafayette and a bachelor's degree in communication studies from Louisiana State. And Laneceya currently volunteers at Baton Rouge Youth Coalition and is a board member of Sexual Trauma Awareness and Response in the Louisiana Crime Victim Reparations Board. Thank you for that work. She also is the Inclusion, Diversity, Equity, and Access Chair for the Greater Baton Rouge chapter of the Associates of Fundraising Professionals. We're also joined by Yuliya Labko, who is the Advocacy and Policy Director of March for Moms and a full-time certified nurse midwife. She holds a master's degree in nursing from Johns Hopkins University and a postmaster's certification in midwifery from Shenandoah University. Yuliya works at Abington Jefferson Health outside of Philadelphia, providing full scope gynecologic, reproductive, prenatal, birth, and postpartum care to people through the lifespan. Thank you for that continuity. She also volunteers within the American College of Nurse Midwives as a mentoring program coordinator for students and new midwives. Laneceya, Yuliya, thank you so much for being here. The floor is yours.
Thank you. Thank you. And good afternoon, everybody. I just want to first start off by saying thank you for spending your lunch with us. And we hope that you find the information that we share beneficial to you and your organizations. So we'll go ahead and get started. So we will be talking about advocacy strategies for maternal health when the movement may feel stagnant. We go through these periods of time where it may be slow, things aren't moving forward. And so utilizing that time to really come together and see what can we do to continue to push the needle when it comes to maternal health and infant health policies. So first, I just want to share a little bit about March for Moms. So our vision is we envision a world in which every person can grow their family with dignity. And our mission is to align all of the diverse voices, whether that's families, healthcare providers, policymakers, community partners, and advocates, to advocate for mothers and families' health, well-being, and equal access to care. And this is our team. So like Jesselyn introduced us, I am Laneceya Russ. I'm the Executive Director of March for Moms. I have been the Executive Director since 2021, and I am actually based in Baton Rouge, Louisiana. And I will let Yuliya go ahead.
Hi, everyone. Good afternoon. Like Laneceya mentioned, I am the Director of Policy and Advocacy for March for Moms. I've been with the organization since its inception in around 2017, 2018, and we work closely together on advocacy priorities, agendas, and alignment within the organization.
All right, so our learning objectives for today is Yuliya will go through some key federal and state legislation that impacts maternal health. We're also going to identify some advocacy strategies that community-based organizations can use to affect change at the local level, state level, federal level, wherever you may be advocating. And then we are also going to talk about ways you can mobilize community leaders, people who have lived experience with maternal health. And then we're going to talk about how to draft an advocacy or legislative agenda for any local and our state policies that you may be working towards.
So I wanted to start with a little bit of background of the types of bills that we have seen in the prior legislative session and the current legislative session being introduced or passed. These bills listed here, majority of them have passed, with the exception of one state bill there on the right-hand side. So I wanted to give a little summary just so we're all kind of on the same page on what types of legislation is actually moving through on the federal level, and then some examples of state legislation. this past legislative session, the Pump for Nursing Mothers Act was introduced and actually passed, which is incredible. It extended protections for employees that weren't previously covered in salary positions to be able to pump at work or express breast milk. It also considered our spent pumping or expressing breast milk as working. So people were able to be paid for that time as opposed to having to clock out and not be paid for that time. And then it extended a period of accommodations for pumping or expressing breast milk from 1 year to 2 years. It also designated specific space within place of work for moms to be able to, or birthing people to be able to pump or express breast milk. There were some industries that were not wanting to be participatory in this legislation. So for example, the airline industry had not said that they were not able to accommodate space-wise within an aircraft for a private space for parents to be able to express breast milk. But in this past 22 legislative session, it was introduced and then passed and signed into law, which was really, really great. The Pregnant Workers Fairness Act eliminated discrimination and ensured workplace accommodations within the workplace for pregnant people. And this also included accommodations that led through limitations that people can have with being pregnant. So it was a standalone bill back in 2012, and then the bill was included in the Appropriations Act of 2023, which was signed into law by President Biden. Into the Light for Maternal Mental Health and Substance Use Disorders Act increased funding for grants to screen and treat maternal health, a spectrum of maternal mental health disorders, including depression. It also funds the Maternal Mental Health Hotline, which has been rolled out. And for anyone, for yourselves or for anyone in your life, it is a great tool that is ready at all of our fingertips now, being connected to our phones so much. So definitely a good resource to look into. The Data Mapping to Save Moms' Lives Act required the Federal Communications Commission to combine federal data on broadband access with data on maternal health outcomes in order to identify connections and see if there's any correlation between the data that we see on broadband with maternal health outcomes. And then this last bill in the federal column is the Triumph for New Moms Act of 2021, which is when it was introduced, and it established an interagency federal task force for maternal mental health. All of these federal bills, majority of them took a really, really long time to move through. And that goes back to our theme of things feeling stagnant. It required a lot of effort from many different players and stakeholders for these larger federal bills to pass. And the federal legislation takes usually a lot longer to pass through and needs a lot more creative inclusion, sometimes in appropriation packages, sometimes as part of other larger omnibus bills to be able to move through. And so for that reason, things can feel like they're moving very slowly. And we'll touch on how we can all find meaning and action within that time a little bit later in our presentation. But I just want folks to know that just because these were introduced very recently and then went on and got passed does not mean that they had been introduced many, many, many times before and kind of had to get tweaked a little and gestated before they were born into an actual law. The state bills in the right column, two good examples were the Remote Patient Monitoring Act, and this was introduced in a couple different states, and it provided a 3-year pilot program to promote monitoring services for eligible individuals under Medicaid. So folks who were pregnant and perhaps having pregnancy complications and needed monitoring and could not make it from a rural area or could not make it for their prenatal care in general. So it provided technology and was introduced in 2 states, actually, in Tennessee and Georgia. In Tennessee, it's still kind of moving through, but in Georgia, it recently passed the state house, which is incredible. And we're hopeful that it continues to move and becomes law in that state. And then on the state level, the Louisiana maternal mental health legislation also passed. And this was a bill that created a mental health task force to advance education and treatment to improve services for moms who are experiencing mental health issues. On the general, state legislation tends to move a little bit at a speedier pace, or can be introduced quicker or can be acted on quicker. Simultaneously, we have to be very vigilant and pay attention, because a lot of times hearings and comment periods come up for these bills very quickly on the state level. So being engaged with your local players and organizations that can help you come in, give written oral testimony, or just support the bill in some sort of way can go such a long way, but we just have to be paying attention when those opportunities are coming up. Next slide. These are more current legislation that was introduced in 2023, so this year. And some of these things, as you can see, are kind of similar. So the Shine for Autumn Act is a bill that authorizes grants and establishes programs to improve data collection for stillbirths. Currently in the United States, we do not collect or don't have a systematic way to look at stillbirth and their causes and outcomes. And many times stillbirth is not included in maternal or family health legislation. So this bill would provide some monetary and system support for this issue. Momnibus 2.0. So in 2019, a group of legislators that sit on the Black Maternal Health Caucus introduced 12 bills that addressed different dimensions of maternal death causes, specifically for Black women. And these bills ranged anywhere from combating lack of information and data, to climate change, to immunizations, to teaching providers equitable and safe care, and anti-racism workshopping, and state level legislation to combat implicit bias. And it is likely to be reintroduced as another package. Again, this package did not pass as a package in the past legislative session, and we're hopeful that it will get more traction and more attention this time around. The Pregnant Women in Custody Act was a act that was introduced and is currently moving through to provide more conscious and equitable care for incarcerated people that are pregnant, and would remove things like shackling during labor and birth. The Maternal Health Pandemic Response Act addresses maternal health during the COVID-19 emergency. So this legislation would open up specific interagency and government level agency opportunities to collect data on pregnant people and how they were affected during COVID, and see how COVID therapeutics, so medication we can take to shorten the span of the disease, affects pregnant people, and also workplace protections. The Maternal and Child Health Stillbirth Prevention Act is a separate act from the Shine for Autumn Act, and it amends Title V. And that would mean that there would be more funding in the Maternal Child Health Services block grants to clarify what we can do to prevent stillbirths. And this legislation also amends what would be allowed in that block grant. So yes, giving more money towards this cost, but really like what that money would be used for. So these are all great things that are about to be reintroduced or have been introduced for us to be looking on our radar, because I think sometimes we walk away from these presentations kind of really amped up. I know I get very excited and I'm like, what can I do? So sometimes just flipping back to a list of current events, current bills, current legislation can be helpful to go back and apply what we've chatted about towards specific bills. On the right-hand side, again, as I've mentioned, Georgia is slowly but surely moving through with the remote maternal health monitoring bill. And then recently, New York State has been trying to amend their parental leave policy. So as the law stands now in the state, partners of birthing parents qualify for paid family leave, but partners of birthing parents who've experienced a stillbirth do not. And so this bill would amend the leave policy for those partners. As you can imagine, you know, it's such a tough, emotional, and challenging time for families and partners, and for a lot of people in their life as well. So for birthing people to be able to have that support at home and be able to receive that from a partner that can take time off of work would be really great. All right, and then moving forward, now that we've kind of like established what is going on out there, which can feel very daunting, and we hear many things on the news and just in general in our political climate, a lot of these bills and issues that I've talked about are incredibly important, but they are definitely not your most advertisable content, let's just say, in legislative world. We don't hear this a lot on the news. But now that we've kind of established a good baseline, Laneceya and I will go over some advocacy strategies for community-based organizations that can both be on an individual person level or as an organization on the local level that you can do to engage in advocacy. Recently, March for Moms has been working very closely with community-based organizations through the Impact program to support their work and enable them to tell us what they may need, what kind of support and strategizing. And part of that was offering advocacy support. So one of the ways that we can support advocacy strategies within community-based organizations is helping them to determine their capacity of team and organization. Many community-based organizations are small, or a few people do a job of 20. Some of you may be in this room coming from community-based organizations or that background, and we can all kind of sympathize with doing a lot with very little. So determining capacity and seeing what would be important and what the goals are is a good place to start. And then brainstorming advocacy and legislative agenda is a good way to organize your thought process and have a plan going forward. And Laneceya will touch on that in a minute. And then identifying maternal health champions. So as I alluded to earlier, really identifying whether it's in your community on a national level, Identifying who those players are to be working alongside with and contributing to their work is really important. I'll use ourselves as an example. People reach out to us through the website quite often, through March for Moms website, and we are so happy to talk to anyone who might want to hear more about our work or get involved, because like I've said, we are doing, trying to do a lot with not a whole lot of resources on the nonprofit level. And that is a struggle many people experience. So we're always happy to talk and help also others identify champions that we know and connect everyone.
All right. So now we're going to go into talking about some of those low lift strategies for advocacy that CBOs can use. So these take little effort, and as Yuliya mentioned, being a small team or even being a team of one, and you just need to do something really quickly to support some policies or legislation that's moving forward. These are some ways that you can do so. So you can draft and disseminate letters of support or petitions. So these are commonly called sign-on letters. I'm sure many of you in this room have received sign-on letter requests asking you to support a particular bill or legislation or program that's being passed. And so this is also something you can do as an organization for yourself. It can also be for the release of reports or anything like that. So for an example, we work closely with Black Mamas ATX, which is a full spectrum doula service in Central Texas. And we talk with them. Texas was holding on to their maternal mortality reports, and they weren't releasing them. And so we talked through sending out petitions and things like that to get them to release this maternal mortality report. So even things like that, you can draft and share with your stakeholders, share with other organizations, or any champions that you may have in your areas to support. Another way you can do this is through social media. So using your social media to inform stakeholders or your communities regarding an issue that is being heard or coming forward, whether that's on a local level, state level, or federal level, that's really something easy to do. Typically, there are people who provide toolkits, so there's already content out there, and you don't have to reinvent the wheel. So that's something low effort that you can do to advocate for a particular bill, policy, or anything that's moving forward. Phone calls and or emails to your elected officials. So the easiest way to do this is to provide scripts to your stakeholders or communities to call or email their elected officials on a particular issue. That way they can already have something down. They're just calling. They might leave a voicemail, or if they're trying to send a quick message to their staffers, all they're doing is copy and pasting or reading the script verbatim. You can also, put in there they can share their own stories. But oftentimes when people are advocating for something for the first time, they don't know what to say, where to begin. So scripts are always helpful. It doesn't take a whole lot of time to write a script for your team or the communities that you represent. But that is a way that you can get your messaging across of what you want to happen in a particular situation. Another low lift strategy is writing op-eds into your local newsletter, to local newspaper, or also any bloggers, like if you have a popular blog or anything in your community, writing an op-ed on talking about a particular issue, but also solutions. So when you're writing your op-ed, you want to put out what's going on with that particular bill, and then have solutions at the end as well. And then, of course, if it gets published, you want to share, send out to your email listserv, share on social media, because that's another way to educate your communities on what's happening. And now we're going to talk about those high lift strategies. So this take a lot more effort, but they're just as I don't want to say they're just as important to do. And one of the biggest ways is social media campaigns. So if you have the capacity and if you have the team or volunteers that can do this for you, you want to draft a toolkit on whatever issue that you might be advocating for or need messaging for. And then you want to send it out to other organizations to join your campaign. So if you are in coalition with folks, if you have advocates or people with lived experiences that want to get involved, these are easy ways for them to share on their social media channels. It'll all be consistent branding, consistent messaging, and it works. You want to include things like sample tweets, quick things that people can copy and paste, sample captions, any stats that they can share. They can schedule them ahead of time. That works great. And there's also something called the Thunderclap, where Yuliya told me about. I had no idea about this. But if you want to have a Twitter storm, if people still use Twitter, there is a software, a website called Thunderclap, where people can sign up ahead of time for Twitter to release all of this messaging at once. And that's pretty helpful when you're doing a social media campaign. Included in that is also like Instagram lives, Facebook lives. Those are things we have been involved in. And also with other organizations talking about certain issues, but also any experts or any advocates that we know will connect other people who might be having Instagram lives or Facebook lives to also include them in that conversation, so we can talk about what they have lived through or what they have witnessed in their professions with maternal health as well. And then also, this is kind of costly, but it's also another way to reach people who aren't a part of your community, is social media advertisements. So like I mentioned, there is a cost, but it is a way for you to reach those people who aren't already a part of your community, whether that's on Instagram or whether that's on Facebook. Mail campaigns, so sending out postcards. Moms Rising, which I'm sure most of you are familiar with, did a wonderful postcard campaign last year during voting season. And they sent out postcards to moms and birthing people talking about voting. They also asked for volunteers to write like a handwritten note on the postcard and send it back to them. So people got that personal touch as well when they received the postcard. And I felt like that was a very successful. I volunteered to send some postcards as well. Said it can be costly to do so, but that's also a high level strategy that you can use in times like these. Also, for in-person meetings with elected officials, if you want to schedule advocacy days, whether that's in person or whether that's virtual meetings with your elected officials, those are also good ways for people to get involved with advocating for a specific bill or policy. And so scheduling one full day with your communities or with your team when you guys can go together. It's always strength in numbers where they can meet with their elected officials. It may or may not be the same, but also you want to create some sort of one pager that you can leave behind with their staffers so that they can remember what you're asking for, what you're supporting, but also to remember your organization, remember their constituents as well. But once again, that takes a little bit of work. It'll take time to create, but it's very helpful for them to remember your meeting and the time that you spent with them. Rallies, which is something that we have historically done from the beginning. You can schedule rallies where community members, thought leaders, or any other partners can come and share their testimonies, share their stories, talk about the issue, but also advocate and have a call to action for solutions is always helpful. And you can do that at, your the local area that you live in, the state capital, or even, you know, federally or somewhere. But just bringing people together also shows that there's people that care about this issue, and we're not going away. So listen to our voices and listen to what we're requesting. And then the last is briefings and other educational opportunities. So you can arrange for in-person or virtual briefings where you're educating staffers on the issue or a particular bill, because they don't look at everything or know everything. So if you can plan a briefing, invite them to attend, and then talk about that particular legislation. You can also invite advocates, your stakeholders, to educate them about it as well, but then also have a call to action, whether that's calling, emailing their elected officials, sharing, talking about it, you know, with loved ones, that sort of thing. All right, we are moving on.
Thanks, Laneceya. Part of the kind of, especially within maternal health and maternal mental health space, we see that mobilizing community leaders and people with lived experiences can really help not only spread the word about specific legislation that's going through, but really give context and a connection and a face to a lot of these issues. And as March for Moms found it, majority of our work focused on maternal mortality. And as you can imagine, it's such a heavy topic. And it's one thing to talk about legislation that's moving through to combat it, or what the causes are and what the statistics are. But hearing from people who have been affected by this life experience really brings a lot more context and honestly makes people a lot more accountable, makes legislators a lot more accountable, makes offices a lot more accountable to do something when they hear our personal stories. And so mobilizing folks who have a lived experience, and it doesn't have to be somebody who personally went through a traumatic event. It could be a friend, it could be a family member. I do this work as a midwife and I'm a provider, and I witness poor outcomes as part of my work and not necessarily on a personal level. So it does not have to be, I'm saying this because I think sometimes we think, oh my gosh, well, I couldn't possibly tell, what story would I tell? You would be surprised if you really sit down and reflect upon hearing things, listening to people, friends, families, bystanders, reading things in your local paper. Your story of how that impacts you is really important. There are advocacy trainings available with several organizations that can help us prepare ourselves or others to be able to tell stories. Stories in a way that's most impactful. And Mama's Voices is one of them. 2020 Mom does advocacy training and storytelling training for folks who have been affected by maternal mental health disorders. Those resources on training exist. You don't have to go it alone. There's a lot of prep and support that people can get. That's the type of mobilization that they choose to do. Storytelling can be done on different levels. It can be done in person. An example that Laneceya provided is meeting with legislators. So really coming to the table and speaking with a staffer and providing them with your story and connecting what the story is and why it matters to current legislation is really important. I'm not sure what the background is of everyone here. And actually I would be curious, maybe in the chat, if you could tell us, have you ever met with any elected official? Have you ever had a meeting, whether it's Zoom or in person? I'd be curious to know feel free to share how it went, in good, bad, indifferent. But it could mean such a big difference to whether or not an issue gets moved through. I've gone to countless meetings where you go into an office where you're not expecting a whole lot, maybe just like ideologically, you know, that this legislator or their staff is not really, whatever bill what we're advocating for might not be a priority. But sharing why you're there and what's going on in your life can make like such a difference, even in the moments where you don't feel like it might. A really good story that I have is I went advocating with a group. It was a group of myself and other moms, and we met with an office that wasn't necessarily prioritizing maternal mental health bills, and the bill we were advocating for it was an appropriations upping of the funds for bills. And a mom in my group shared a story about how her struggles with postpartum depression, and the staffer kind of perked up and he said, oh, well, my wife and I just had a baby and this resonates so much with me. I didn't realize that that's how it all connects. Like, I totally hear you. And I think, and following that he escalated our ask, and actually this legislator became a sign-on legislator for us to move through these appropriations. So it's really incredible what even like a 5-minute story can do. So we never underestimate that as a way to connect with people and legislators. It can also be a good tool to use in the times of when things feel stagnant, because sometimes just getting on your legislative community radar with your story also positions you as an expert. So when time comes that things are moving through, they may call upon you as an expert to review a bill, to ask that you as a constituent how it might affect families. So it's really important to kind of consider the strategy. It's not for everyone because it can be quite traumatic and taxing to tell a story that might be really emotional and personal for you, but it can be a really nice strategy to move things along and be on the radar of your legislators. Coalitions that also can include community members is a good way to mobilize folks with lived experiences and utilizing existing frameworks. So again, we don't have to reinvent the wheel. We can use training opportunities from other organizations to give us those tools and step-by-step guides on how to tell our story effectively and succinctly, and tailor it to who you're speaking to. That story is the same. We've lived kind of our experience, but how we tell it can kind of change from time to time. So definitely consider this as a strategy to move things along. Oh, hold on. Let's see. I do see some chat. Yes, Chris. I think Chrisette. I'm saying the name correctly. Folks have done it. It's not the most positive experience. One person wrote, Jocelyn also said very intense. It can be an intense experience to tell your story. And Laneceya and I have recently heard from an advocate that told us that he didn't understand the kind of impact of taking time, like stepping away from storytelling as a strategy. So sometimes just taking breaks is so important. We might be doing this work and it's so important, but taking a step back, especially maybe in times where things are not moving through, and like leaning into that time to take a beat to kind of fill our own cup is really important as well.
All right. So we're gonna kind of wrap up everything by talking about a practical tool that CBOs can use, which is drafting an advocacy or a legislative agenda for your own organization. And so I wanted to talk a little bit about the components of a legislative agenda, but also show you an example of how it can look. So you want to start off with a brief overview. So you're just talking about your organization in that brief overview. And then you want to lead into an introduction, which is maybe about 1 or 2 paragraphs. You want to, in that introduction, you want to explain the problem and cite your key points and any relevant facts and statistics in that introduction. And this section, you really wanted to set the tone and urgency for the rest of your document. Then you're going to move on into background information. So the background information can consist of maybe 3 to 5 paragraphs. That's when you're going to go a little bit more in depth about the problem. You're going to still share some relevant facts and stats with credible sources. So we definitely want to make sure we use credible sources and citations. And then you want to go on to mapping out how you're going to explain your priorities as an organization. Depending on what you're advocating for, everyone's priorities will be different. So for each priority, you want to explain why it's an issue for you and or your stakeholders and or your communities that you're serving or working with. Then we want to lead into a call to action. So maybe about 1 paragraph explaining why a decision maker should care about whatever issue you're advocating for. And you want to close it out with a clear call to action. So you want to use some action words. So like mandate, like when you start off, you want to use things like mandate or include or develop, fund, establish, that sort of thing. And you also want to make sure that your name, you're mentioning your organization's name throughout this agenda, because ultimately you want to be able to share this with externally with elected officials, with advocates, with champions, that sort of thing. And then you're gonna tie it up in a nice bow with a conclusion. And in your last paragraph, you're gonna pull everything together with another strong call to action. And then you're gonna end it with your organization's name, urges whomever you're trying to get to be supportive of this bill by enacting the solutions that you came up with your priorities. Let me go forward. I went back too much. I wanted to show you guys an example of this. A great example of a legislative agenda, I am using Society for Maternal Fetal Medicine's one from 2021 to 2022. It's 2 pages. You can see they started off with an overview. They started off with their commitment, and then they outlined their policy priorities. And so some of the things you can see, like they wanted to prioritize and strengthen the investment in research for pregnant people and goes forward. And of course, their organization focuses on high-risk pregnancy. So they made sure to include that they want to ensure that high-risk pregnant people have access to maternal fetal services, that sort of thing. And then you can see they go into detail about how they would have access. So like access to telehealth, training, that sort of thing. And they use credible sources. As you can see, they cited the CDC for one. This is just one example. There are others. I have seen legislative agendas that can go up to like 25 pages, which can be a lot, especially for a smaller house like March for Moms. But this is totally fine. Like 2 pages, you can design it as much as you want to. You can condense it as much as you want to, as long as you have those points laid out, your priorities and the solutions to that. All right, Yuliya.
Thanks. We also wanted to give you some partner resources that can help you in this advocacy journey. The first one is actually a March for Moms toolkit. We've created a toolkit to help people becoming effective advocate. The audience for the toolkit is really somebody who does not, may not know a whole lot about maternal health or legislation. So it's very broken down to help you from kind of step one to educate yourself about statistics, and then give us a little framework on how to move forward, how to schedule a meeting, what to say, when to go. So it's a nice resource that's available on our website. Every Mother Counts is a really great organization. So check them out in general, but they also have an advocacy toolkit that was released a couple years ago that is really excellent. And I highly recommend checking that out. Advocacy toolkits, just like Laneceya mentioned with the advocacy agendas, can be kind of long, but they are worth it. And you can pick out little pieces out of them that may be specifically helpful to you. So don't feel like you must read a 60-page document. However, definitely browse through at least most of it. A good one that just came out that is very excellent is the National Partnership for Women and Families, and it's called Raising the Bar, the Advocate Role. And that helps kind of break down the theory behind advocacy, but also give people checklists and very concrete, specific ways that they can become an advocate within their community. You can voice your support. I put in here the Black Maternal Health Momnibus that I talked that will be reintroduced, but really any kind of bill that's moving through, voicing your support for those, using the resources we mentioned, or any resources you might find that are helpful specifically to what's going on in your community is great. You can definitely check out the professional organization of whatever issue that is near and dear to your heart. So one of the professional organizations that focuses on maternal health and maternal health outcomes is the Society for Maternal Fetal Medicine, which is how we saw that resource. We frequently partner with and look and keep up with professional organizations that are working in the maternal health space. So that's, American Congress of Obstetricians, American College of Nurse Midwives. So I say this because most of them already have resources. Again, don't feel like you have to create anything yourself. You can always see what's available and utilize that. And then consider attending our events. Of course, we have to plug ourselves to raise awareness for maternal health and experience advocacy in action with us. We do typically, COVID kind of course, as with everyone, derailed us a little bit, but we do hold advocacy events and advocacy campaigns. And if you follow us on social media or sign up for our newsletter, we frequently send out opportunities for people to voice their support or have a sign-on letter or forward what our partners are putting out. And again, connecting all of us is really important. So we definitely can